I know we have people of all different professions here and age range, but could you tell us a little bit about what we're doing at St. Bernard's for the treatment of DVT, I believe is what it's called?
Correct. So we're excited to discuss this issue. For the longest time, we've been very interested in blood clots and blockages in the arteries, whether that's in the heart or in the legs or in the brain sometimes. We've been ignoring blood clots in the legs because we did think that we are doing a great job with treating them. Actually, we figured out that we're not doing a very great job. So what's a blood clot? So the blood inside the vessels, whether that's a vein or an artery, has to be in a liquid form. If you get injured and the blood seeps outside of that, it has to clot, and that's the normal way. The abnormal way, if you form a clot inside the vessel that is not injured. And if that happens in the leg, in the veins, now we're closing the exhaust where the blood cannot go back from all these muscles in the leg and go back to the heart. And that will be a problem because if you don't have an exhaust back, then all that blood is accumulating in the leg. And if it accumulates in the leg, over time it will cause swelling, cramping, pain, redness, lots of problems. So for decades, we've been treating the blood clots in the leg with blood thinners. We see you, we see the clot, we give you a blood thinner, problem solved. Actually, that's not correct because in about 30% of the time, people who get clots in the veins in their legs will have chronic problems. What are these chronic problems? The chronic problems will include, well, pain for decades, that is not going away, swelling for a very long time, fissuring, cracks in the leg, and then ulcers as well. And unfortunately, some of these patients will lose their legs because of these chronic problems for the clots. So we've been thinking, how can we improve our outcomes? And recently, over the last 6 months, in St. Bernard, we started this novel, great, and exciting procedure where we go with a catheter, a small, very small catheter. We go up in the vein where the clot and the blockage is, and then we infuse a medicine, and that medicine will make the clot very soft. It's a clot-busting medication, and wait a little bit until the clot is soft enough, and then with the same catheter, we macerate it, and we suck it out. We aspirate it, and now we have a clean and clear vein, and that will restore the normal blood flow to the leg, and we found that we can avoid lots of long-term complications that our patients have to live with for their entire life. So we're very excited to announce that we are doing these procedures. We started doing them. We've seen great results and great success.